Greetings, I'm Edward Chang from the Department of Plastic Surgery at MD Anderson Cancer Center. I'd like to thank PRS for the opportunity to provide a video discussion on Dr. Lee's study looking at the use of the lateral upper arm flap for speech rehabilitation in patients undergoing a total or subtotal laryngectomy. Overall, I think the author should be commended for really honoring the most basic premise of plastic and reconstructive surgery, which is restoring form and function. In patients that are undergoing a laryngectomy, one of the most critical aspects of the reconstruction is to be able to swallow and eat normally. And the other major function that needs to be restored, if possible, is the ability to be able to speak and to be able to communicate verbally. While I do think the lateral upper arm is an excellent donor site and a very reliable donor site for reconstruction of these defects, I don't think that this is the critical aspect for why patients are able to achieve speech rehabilitation. These types of defects can be reconstructed using any number of different fasciocutaneous flaps, and the decision for which donor site to use is going to be based on a number of different factors. Patient body habitus, surgeon comfort, surgeon experience, those are the factors that determine which donor site is used. In my opinion, the most important factor for how patients are able to achieve speech rehabilitation in this study is how the laryngectomy was performed, which is not well described in the study. I had actually review the anatomy in order to understand what the authors are trying to do. The laryngectomy either has to preserve the epiglottis or it has to allow the patients to be able to reconstruct the trachea more than the pharyngeal defect. They have to be able to reconstruct their trachea independently from the pharynx and the esophagus, and that again can be achieved with any number of different flaps. And the authors opted to use a lateral upper arm flap, but in my opinion, any of the other fasciocutaneous flap donor sites could have been used very reliably in order to reconstruct these defects. So again, I think the laryngectomy is the most critical aspect and not the donor site that is selected. Thank you so much again for the opportunity.